In this section, we'll look at 5 issues: how not to die suddenly of undiagnosed heart disease, how not to die slowly and painfully of chronic progressive disease, how not to die of an infectious epidemic, and what about our future generations, how about our children. And we'll also see what we can do for our elders, our parents, how about increasing their quality of life. We welcome Dr. Ellis Jayachandran Vivian, MBBS D Ortho from CMC Vellore, FRA CGP. He has a scope certification from the World Obesity Federation. He's a member of ANZOS, the Australian New Zealand Obesity Society. He was an observer of Dr. Jason Fung in his clinic in the reversal of diabetes and management of obesity. Welcome, Dr. Vivian. We are happy to have you for this interview.
It's a pleasure, Tina. Thank you. Thank you for having me.
Okay, so let me go straight to the questions. How do we know if we are healthy? How do we not die of undiagnosed heart disease? I'll split these questions in 2. The first part of my question is, there has been a sudden rise in heart attacks. People are just dropping dead, Relatives are saying, oh, he's young, he's just 40, he's just 45. We didn't know he had heart problem. He just was taking basic medication for either blood pressure or diabetes, and then suddenly he died of heart attack. David Bobbitt in the documentary movie The Widowmaker says about heart disease, the first time you know you have the disease, you're dead. The first part of my question is, how do I know whether I have heart disease while I'm still alive? The second part of my question is, I remember the incidents of one of my relatives going to the doctor and coming back. So when they returned, I asked them, so how are you? How did the visit go? And the person said, oh, everything is fine. And then they added, saying the doctor has changed the dosage of this medicine and has increased it. And he said that this medicine is not working, so they're going to try a stronger drug. So I was like, so this person comes back with an increase and a different medication. So how does that mean he or she is fine? How is that healthy? So what is healthy? What is fine?
That's a very good question. When we look at a person, there are certain things we can look and see. These are all markers that there can be an underlying problem. Things like skin tags, especially around your neck, shin spots, edema of your feet, acanthosis nigricans. This is a conglomeration of dark spots that come around your neck, an increased abdominal circumference. They just look big. An increased neck circumference, and xanthomas. They are small yellow fat-like deposits around the eye. These are things that you can see, and you can tell the person that they have an underlying metabolic problem. The next thing you can do is to do a few first level tests. You can do some measurements and then see if you are outside of the normal or recommended values. If you go to a doctor, they'll do your blood pressure. You can check your cholesterol. And by cholesterol, I actually mean just not the total cholesterol, but actually the HDL cholesterol and the triglycerides. Third is your HbA1c. Next is a HOMA-IR. It's a complex calculation that is taken from your fasting blood glucose and also your insulin. It's just not adequate if you do just a fasting blood glucose. You also need to do your insulin levels, and I'll explain why. Going through each one of them, your blood pressure, your doctor measures your blood pressure. The normal blood pressure is supposed to be 120 systolic and 80 diastolic. If you're within those numbers, you're fine. If you're outside of those numbers, if your number is more than 120 systolic and 80 diastolic, then your doctor will see what causes that high blood pressure. It could be due to smoking, anxiety, obstructive sleep apnea. Some medications can cause high blood pressure. Kidney issues can cause problems with your blood pressure, and metabolic health issues. Once you know you're outside of the normal recommended values for your blood pressure, then that will trigger your LCHF doctor to go and do some more testing on you. The second test is the cholesterol. As I mentioned, it's just not the total cholesterol, it's the HDL cholesterol and the triglycerides. The normal for a triglyceride is somewhere between 70 to 100 milligrams per deciliter. Optimal is to be less than 70 milligrams per deciliter. Anything more than 100 milligrams per deciliter is high. The HDL, it's supposed to be more than 40 milligrams per deciliter in men and more than 50 in women. So if you have a combination of high triglycerides and a low HDL, then that's another abnormal test pointing towards metabolic disease. The third one is your HbA1c. The HbA1c is a 3-month average of your blood sugars. Less than 5.4 is considered normal. 5.5 to 6.4 means two things. It's either pre-diabetes. It also puts you at increased risk for cardiovascular disease. The next is a couple of blood tests. One is something we know very often. It is the fasting blood glucose. You check your sugar levels early in the morning, but at the same time, we also do an insulin test. Look, some people may have a fasting blood glucose that is normal, but what we do not know if we don't do an insulin test is to see how hard your body is working and producing insulin to maintain a normal fasting blood glucose. So just a fasting normal blood glucose is not a very complete test to tell you how your body is functioning. You need an insulin test as well, the fasting insulin, and combined with this, you can calculate your HOMA-IR. It's your homeostatic mechanism of insulin resistance. That can tell you whether you're insulin resistant or not. So these tests are indicators of how healthy you are.
Okay. So these are numbers that one should achieve without any medication, right? Because I've heard people say, oh, I'm fine, my sugar is normal, my BP is normal. And then in the course of the conversation, they say, I'm having this drug to reduce sugar and this drug to reduce BP. So the point of these tests is that you should have them without any medications. Am I right?
Yes, that's the optimal place is to achieve these numbers without the use of any medications, which is the best. We try to achieve this in the long run with an LCHF lifestyle. I just want to explain this with an analogy. If somebody says, okay, this is the normal numbers you want me to be under, and I am able to achieve those numbers with medications. So what's the problem? I'm still normal. Okay, now let's just take and assume somebody has blood pressure that is caused by smoking. So you can take some tablets to reduce your blood pressure and continue smoking, but you're going to end up with the side effects of smoking. Lung cancer can be down many cancers can come from smoking. So just having a normal blood pressure, taking a blood pressure medication when smoking is the cause, and then satisfy ourselves saying my blood pressure is okay with some medications, it's not a very good approach to good health.
It's interesting that you mentioned the HbA1c in the context of cardiovascular disease risk, because we usually associate it only with diabetes and blood sugars. So could you elaborate a bit on that?
A diagnosis of diabetes, cardiologists consider it as equivalent to having actually a cardiac event, something similar. So diabetes is actually considered as a cardiovascular, it's a huge cardiovascular risk factor. And pre-diabetes means a patient is not only at risk of diabetes, they are also at risk of cardiovascular disease. And that's why that segment where somebody is pre-diabetic also puts them at cardiovascular risk. So the patient can just not satisfy themselves saying, oh, I'm just pre-diabetic. Actually, they are also pre-cardiovascular disease.
Oh, wow.
And that's at those numbers.
These tests that you mentioned, apart from the blood pressure test, it's just a one-time simple blood test, right? You go on an empty stomach for 8 hours to any diagnostic lab, you give a blood sample and head back home. There's no need to return to the lab after 2 hours of eating, no need to hang about in the lab, no other complicated procedures involved, right? So it's pretty simple.
Yes, look, when you take these tests for your metabolic health, it's you don't need to do your fasting and your postprandial. Those tests have their own values in different clinical scenarios for the progression of diabetes or to dose your insulin or check for gestational diabetes. So those tests have their value, but just for screening purposes, these tests give you more value for your money and give you a better picture of your health. So all you need to do is just go get these tests. Also ask the lab to report these tests, the results of these tests back to your LCHF doctor. So they can put it, store it in their software, and then monitoring it in later as you progress in your health journey becomes easier, and you have a visual pattern of how you panned out as the days go by.
The basic level 1 tests are slightly different from the ones that are usually recommended. For example, the insulin test. So can you explain that?
Okay. I just want to again explain this test with an example. Okay. We all know when you put a duck in the water, it swims. It goes from point A to point B. What we do not know is how fast or how hard the duck is paddling under the water due to the force of the stream of the water underneath. All we see is the duck going from point A to point B. So that is what your fasting blood sugars show. They just tell you that you're normal, but it's your fasting insulin that tells us how hard the body is struggling to maintain that normal fasting blood sugar. So I would treat a fasting blood sugar normal value with a little bit of pinch of salt. I would always say, okay, this person is having a normal fasting blood sugar, but underneath all this, is their body struggling? Is there too much insulin resistance in the body? Is the body pumping out insulin to maintain this normality?
And that's why we use the fasting insulin.
That is why fasting insulin test is used along with a fasting glucose test, and the HOMA-IR value, it computes your insulin resistance. Insulin resistance is the precursor to diabetes. Somebody who is insulin resistant are on the journey and going down the road to meet their friend called diabetes a few years later.
And probably also,
and once you get diabetes, as I said, there are a few other friends down the road, cardiovascular friends as well.
So what do we do next? How do we know whether a person needs to test for heart disease risk?
We need to do 2 tests to further risk stratify ourselves in regarding to cardiovascular risk. One is the coronary artery calcium scoring, and the other is the stress echocardiogram. These tests should be strongly considered if you have one visible marker, any of the visible markers, especially increased abdominal girth or increased neck circumference or xanthomas, and one set of high values in any of these tests. If you have high blood pressure, you are at risk for cardiovascular disease. If you have high triglycerides and a low HDL, again, a deadly combination in the cholesterol, that should provoke you to do the second line test, or the HbA1c is above 5.5. And if everything is normal and you're a smoker, you put yourself at increased risk for cardiovascular disease. So you should have the second line test to see what's actually happening in your heart.
Many times I see that patients are advised only the stress echocardiogram, the treadmill test, but not coronary artery calcium score test. Should the CAC scan be recommended as well, apart from the treadmill test, and why?
When you get a stress echocardiogram, you're put on a treadmill and they see how your heart is functioning under stress, just after stress. Now, you can only see these changes if the coronary artery, that's the artery that supplies your heart, is blocked more than 60-70%. It's a test of how the heart functions. It is incomplete if you don't do a coronary artery calcium score, because the coronary artery calcium score tells us the buildup of calcium in plaques. And as soon as the coronary artery starts building up calcium plaques, the coronary artery calcium score starts rising. So it will even find out blockages in the early stages. Taking just a stress echocardiogram is actually an incomplete test to risk stratify you in terms of cardiac diseases. The traditionally used Framingham risk assessment tool is not complete. It's not a very good tool, and it misses many key issues, especially hereditary and genetics. And it was a good tool years ago, but it's outlived its usefulness now. There are better tests that will risk assess you for cardiovascular risk. The stress echocardiogram is a test that depicts the functioning of your heart. The calcium artery scoring is a test that depicts the form of your heart, form and function.
Oh, wow. Okay. So to know both the form and the function, then we need to do both tests.
Both the tests.
So that is why a lot of people miss out. They perform well on a treadmill test, but then suddenly they get a heart attack and nobody knows that they had heart attacks in the first place.
Yes. I would consider doing only one test and not the other is incomplete.
Okay, so what does one do if the reports show abnormal values on the second level CVD risk diagnostic tests?
Okay, once you have an abnormality in your second level tests, especially your stress echo or your coronary artery calcium scoring, the CAC score actually is, there are various numbers attached to it. I think it's this time your LCHF doctor and your cardiologist will coordinate, and they may end up advising either a formal angiogram or a CT angiogram.
Okay.
At this point, I would like to stress that anytime you visit a specialist and get these third level and diagnostics tests done, it's always better to go back with the reports back to your LCHF doctor, who will coordinate your care.
Okay. How about people who are known diabetics? I've heard people say, I only have diabetes, I don't have heart problem. So what about them?
As I told you earlier itself, the diagnosis of diabetes is considered equivalent to a cardiac event by some cardiologists. So if you have diabetes, you have increased cardiovascular risk. Now, if you look at the root causes of both of them, the root cause of diabetes is insulin and leptin resistance, and both are inflammatory conditions. And the same goes with cardiac disease, where there's an inflammation and the plaque is a result of the inflammation and injury to the inside of the coronary artery. So both are related one to the other, and both have a common underlying problem, which is increased inflammation. So if you are a known heart patient, test for insulin resistance. If you are a known diabetic patient, test yourself for coronary artery diseases. Start with the level 2 test, and then if necessary, level 3 test in consultation with your cardiologist. Apart from diabetes, there are other conditions that are also risk factors for developing a cardiovascular disease and ending up with a cardiovascular event. Gout is one of them. A strong family history of heart attacks, deaths in a young 50, 60-year-old person in the family, smoking, recreational drug use, alcohol use, they're all risk factors for cardiovascular diseases. So if you have any of them, it is better that you get risk stratification for cardiovascular diseases by doing both this coronary artery calcium score and the stress ECG.
So how does one proceed if they have dangerously high values in these tests?
Look, dangerously high values are causes of concern. It has to be attended quickly by your LCHF doctor and your specialist. For example, if there is a very high degree of heart blockage, your specialist may want to put a stent in or do some, CABG or something like this. It's an open heart surgery. If your sugar values are very, very high, your LCHF doctor may decide to give you insulin shots in the short term to get you out of the danger first. In the long term, we can then make lifestyle changes and dietary changes to address and mitigate these risks and actually aim for reversal of some conditions as well.
Okay, say suppose one doesn't have these dangerously high values and may not require immediate surgical intervention, operations or something like that. Can insulin secretion be reduced? Can calcification of the heart be reversed?
Yes, look, dietary and lifestyle changes can cause a huge change in insulin secretion and insulin resistance. And similarly, you can also actually reduce your calcium plaque by a very good LCHF lifestyle, LCHF food, intermittent fasting, and proper supplementation. It is possible, definitely possible, to stop the plaque formation from growing and becoming bigger. And in certain conditions, you can actually reduce the plaque formation. So it is possible by lifestyle changes, along with what your doctor may want to do initially, if there is any need for acute intervention.
So what if a person just has, just one or two visible markers, tests are fine, or maybe they have high values in just one test, or they have minimally above normal values in two tests. So if it doesn't seem like the danger is too high, but supposedly minimal, then what should a person do?
If your results are deemed by your doctor not to be something that needs to be either investigated further or attended to on an urgent basis, they can always advise you to change your diet and your lifestyle. You can check after 3 months. So go to your LCHF doctor. A visit to the doctor may be helpful because they may be able to see things that you don't see, and they may be able to put combinations and figure things better. So I would suggest if you get these blood results, just don't look at the values and try to address them by yourself. Please go visit your LCHF doctor. They'll be able to figure out what's happening and advise you from that point onwards. And they may be able to pick up other things that you can't see or you don't know about.
Okay. What if everything is fine? There are no visible markers, all test values are fine. So should I still change my diet? I've had people ask this on our YouTube channel. I'm normal and fine. Should I still change my diet? Should I still change my lifestyle?
Yeah, good. If everything is fine, it means something that you're doing, either your diet or your lifestyle is good, actually. So congratulations, don't worry. Keep on rechecking. Recheck after 2 to 3 years. But if you get any of the visible markers, check immediately. Or if you hit 40 or 45, depending on what your risk-taking capacity or what your comfort level is, check these levels when you reach that milestone. Check every 2 years after that. And if you get any visible marker or a symptom like shortness of breath or a joint ache or any of the side effects of metabolic disease, go and get them checked as soon as possible.
Okay. So how often would you recommend that one repeats these tests?
Okay. Look, if you're doing a fasting insulin and a HOMA-IR test and everything is normal on your first screening test, you can repeat it at 1 to 2 yearly intervals or earlier if you notice any symptoms. But if you're on medications and doctor has made any medication changes, we always would like to check and see what the intervention and the medication has done to you over the 3 to 6 month period. So go back to your LCHF doctor. They will check you maybe in 3 or 6 months to see what benefit we have derived and take it from there. For the triglycerides and HDL, if everything is normal, again, we can check in 1 to 2 years or earlier if you notice any symptoms like a xanthoma or shortness of breath. And again, if there are medication changes, go back to the doctor, LCHF doctor, and they will check you in 3 to 6 months to see what benefit we have derived from lifestyle changes and medication changes.
Okay. Thank you for shedding so much light on the whole testing thing so that we can know which test to take and what they mean for us.